Welcome to Your Health, where we explore the latest in health across the country. I'm Erica Cardenas. It's Skin Cancer Awareness Month, so it's time to start thinking about your annual checkup. But before we give you the tips you need, let's take a look at what's coming up on the show. Maintaining your eye health with the latest technology. We'll talk about the importance of getting counseling during the pandemic and the difference rehab can make for those with pulmonary disease. All that and more on this episode of Your Health. Skin cancer is the most common cancer in the U.S., and with it being Skin Cancer Awareness Month, we wanted to get the facts on what you need to know. Joining us now is Dr. Ariana Rodriguez from the Southwest College of Naturopathic Medicine. Doctor, thank you so much for being with us.
Good morning, Erica. Thank you for having me.
First off, why is skin cancer awareness so very important?
In the U.S., more people are diagnosed with skin cancer each year than all other cancers combined, meaning that 1 in 5 people in the United States will develop skin cancer by the age of 70. The more that you know about it, the earlier it is caught, the better off you'll be.
Now, many people have avoided annual checkups during the pandemic. Why is it so important to see the dermatologist during this time?
Yeah, so dermatologists are going to perform really thorough full body skin examinations. They're going to check for not just any cancerous lesions, but they're also going to check for any precancerous lesions. They're able to look in places that we're not always able to see or that we might not always think to look in.
Now, doctor, skin cancer is one of the most preventable forms of cancer. Can you tell us why that is?
Yeah, so the reason for that is that there are several risk factors for skin cancer that are environmental or lifestyle risk factors, meaning that they're modifiable and avoidable. They're things that we can do to reduce our risk of developing skin cancer. One big one is decreasing our amount of UV radiation by just decreasing our sun exposure. Reducing inflammation in the body by increasing our intake of antioxidants and antioxidant-rich foods. Smoking cessation is also a really good way of reducing inflammation in the body. Avoiding indoor tanning and indoor tanning beds. All of these things are ways that we can reduce our risk of developing skin cancer, which is why it really can be a preventable form of cancer.
Absolutely. So tell us, how important is sunscreen and what should we be using?
We know that it can reduce the development of actinic keratoses, which are kind of known as these precancerous lesions, and it can also reduce the prevalence of skin cancers. When you're choosing the type of sunscreen that you want to use, you want to look for something that is broad spectrum, meaning that it gives you UVA and UVB radiation protection. The types of sunscreens that you're looking for are going to contain zinc oxide and titanium dioxide. These are inorganic flocks that are going to provide you protection from the sun. You also want to look for sunscreen that is water resistant. If you're going to be swimming in the ocean or swimming in the pool, looking for sunscreen that is at least SPF 30 all the way up to SPF 50 is going to be your best bet for the type of sunscreen that you're looking for.
Now, doctor, is there anything in particular that we should be keeping an eye out on our skin that might be an indicator that something is wrong?
Yeah, so when you go to the dermatologist, they're going to talk to you about the A, B, C, D, E's of melanoma, and that's kind of the checklist that we run through for any lesions that we think might be suspicious. So A standing for asymmetry, B standing for borders, C is color, D is diameter, so anything larger than 6 millimeters or about the size of a pencil eraser, and E is for evolution, so how has the lesion changed?
Now, Dr. Rodriguez, any final tips or advice that you have for us?
Yeah, so, make sure that you're doing your own skin checks. If you are going to be out in the sun, make sure that you're covering up, wear a big fancy hat, make sure that you're wearing sunscreen and remembering to reapply.
Awesome. Such great information. Thank you so much for your time and for being with us. If you'd like more information, head over to the website. Our eye health is crucial to our overall health, and at Stanton Optical, they can help you with all of your eye care needs with your state-of-the-art technology.
Stanton Optical is an optical retailer that provides eye exams and glasses for every budget. Stanton Optical came to San Diego in 2016. We started off with a store in Santee and have grown to 8 stores here in the county. At Stanton Optical, we offer a comprehensive eye exam. That means we don't skip any testing in order to give you the best exam possible. It is very important to have an annual eye exam to check and monitor the overall health of your eyes.
In 3, 2, 1, open up.
The first part is our pre-test, where our patient care specialist will take you through the exam using our state-of-the-art technology and equipment. The reason why we do so many tests is because we're looking for early stages of glaucoma, diabetes, macular degeneration, and cataracts. What separates Stanton Optical from other optical retailers is our extremely competitive pricing and our cutting-edge telehealth technology.
Maybe I'm gonna go ahead and have a seat.
Hello, welcome.
Hello.
A telehealth exam is a comprehensive eye exam that utilizes telecommunication technology to remotely communicate with the optometrist. This allows us to effectively and accurately provide an eye exam without direct contact with the doctor, ensuring maximum safety protocols. Customers are usually very impressed with the way that the eye exam has evolved. Our system, that is proprietary, was invented by Stanton Optical and solely used within our stores. Here at Stanton Optical, we follow all state and CDC guidelines. We require face coverings and temperature checks for all employees and patients. We practice social distancing by ensuring appropriate space between patients and employees. Face shields and dividers are also utilized throughout the store. All common areas and frames are sanitized after every transaction.
Those are very nice.
At Stanton Optical, we have thousands of frames, and our associates have been trained to find the right frame and style for you. We pride ourselves in making sure that you do look good before you leave the door.
Buy one, get the other one free.
Everything in our store is buy one, get one free. And as long as you make an eyeglass purchase, then the exam is included as well. And we do have promotions to accommodate almost any budget. With our buy one, get one free, you can choose any 2 frames that you wish, whether it be a clear pair, sunglasses, you need readers, or even safety glasses. It's all included. We offer a wonderful selection of safety frames with no additional fees. We also offer complimentary routine maintenance of your glasses. You can also see us with an outside prescription, and we accept most vision plans. To schedule your appointment, just go to stantonoptical.com and choose the location that best suits you. Come on in and we'll see you soon.
One good skin tip to follow is to stand in the sun between the hours of 10 a.m. and 4 p.m. as it's the most hazardous time for UV exposure here in the U.S. Here's what's coming up on the show. How you can ease the pain of neuropathy and getting the help you need through counseling.
Diet, exercise, and healthy blood sugar levels are keys to an active lifestyle. Now you can support healthy blood sugar levels the easy way with Axelin. With a proper diet and exercise, just 2 Axelin tablets each day help support healthy blood sugar levels. And Axelin's available without a prescription. Promote healthy blood sugar levels the easy way with Axelin. Enjoy an active lifestyle with diet, exercise, and Axelin. Order today at Axelin.com or Amazon.
Neuropathy is more common than you think, and the doctors at True Health can help your symptoms with your groundbreaking treatments.
So neuropathy is actually more common than we think, and it is nerve damage. So there is over 100 reasons to why neuropathy happens. There is diabetic neuropathy, there is chemical and medication-induced neuropathy. There is also idiopathic, which means we don't know why it happens. But regardless of the reason, we need to know why it's happening and how to treat it. Over time, as these nerves are damaged, they cause patients symptoms like tingling, burning, cramping. Patients are not able to sleep. So with time, this can take a big toll on patients' quality of life. It's very important to treat neuropathy without medication because the medications are simply designed to mask the problems. So as we continue to mask these symptoms, they're just going to get worse. And a lot of these medications, they actually numb your brain, which means they numb the pain. They don't do anything about the root cause of the problem. Our most successful patients are ones that are highly motivated. They don't want the pill for an ill formula. We are the type of clinic that will work with people who are highly motivated to get better. In doing so, using these FDA-approved, groundbreaking treatment modalities, we're able to remarkably see patients do better. Our patients actually do really, really well, where we're able to see these symptoms go away, because your body can heal. Your body can heal and wants to heal without medication.
Once the regimen was established, I felt comfortable with it, and I have shown nothing but marked improvement. When I first came in, it looked like this. Now that I'm completing my treatment, this is what I look like. Prior, I was experiencing neuropathy and cramps during the night. I couldn't sleep all night. Presently, I can sleep the whole night. I'm walking without a cane, and my quality of life has vastly improved.
So when our patients come in for nerve damage screening, we do a touch-based exam because these patients have been poked and pried so many times, so this is completely pain-free. This is one of our very severe cases, and you can see that because of the many areas that they have complete black. Black is total loss of function. You can see that just few short treatments later, they went from this to this, and this is how we know that they are actually progressing, and then they're improving and their symptoms are going away. At True Health, we pride ourselves in treating all patients like family. So we bend over backwards for our patients when they come in here for treatments. They want to be here, they love coming here. We have a location here in Chandler, Arizona. We're also located in Scottsdale. And we are ready for you to come in, again, for that free exam and consultations where we can go over your symptoms, see if you make a good candidate for the treatments that we have. We are ready for you. Let's get your quality of life back. You have nothing to lose but your neuropathy.
Frontline workers, caregivers, parents, and everyone in between are struggling with the impacts of the past year, but there is help. Let's take a look at the Resilient Arizona Crisis Counseling Program.
Resilient Arizona is a critical service brought together in response to the pandemic and the individual social and emotional needs, the isolation that comes with the pandemic, and the fear, and really being able to provide a service and support for individuals to help cope with those and build resilience through the pandemic. So the Resilient Arizona program came about with an opportunity from the federal government to provide support for individuals impacted by the coronavirus pandemic. So the Arizona Department of Emergency and Military Affairs, as well as the Arizona Healthcare Cost Containment System, managed the program, and we're able to operate that through Solari Crisis and Human Services, as well as a collection of 6 community providers throughout the state. The services are available through Resilient Arizona statewide to anybody impacted by the pandemic that are struggling with some of the emotional challenges that can come along with coping with such a large issue and challenge affecting our community. The services are free and confidential, and they're available in both English and Spanish. The services for Resilient Arizona are provided in person, telephonic, or through a telemed video conferencing service.
Resilient Arizona provides the opportunity for residents to learn coping skills, to be connected to resources in their area locally to provide help beyond the counseling, and the counselors can help residents deal with grief, stress, anxiety, and many other things related to the COVID-19 pandemic. What people need to understand about their reactions to the pandemic is that no one has been through this before, so the things that they're experiencing are natural reactions to extraordinary events, and so helping people understand that often helps them cope with the situation better. Traditional mental health services treats diagnosed illnesses, whereas crisis counseling seeks to prevent the onset of diagnosable disorders. So basically, people are learning how to cope with situations that they haven't been in before, and we're trying to treat people upstream before these situations and their reactions to them develop into mental disorders. When the crisis counselors are providing their services, they keep no formal records, and so this really is an opportunity to speak with someone completely anonymously if desired. Confidentiality is secure, and the services are 100% free. We invite anyone who is suffering the effects of the pandemic, be it depression, loss, grief, anxiety, stress, please reach out to us. We are here to help. While the counselor-provider hours will vary, help is available at 211 Arizona in English and Spanish 24 hours a day, every day of the week. Simply dial 211 to connect with a counselor today.
Another tip that can't be overstated, wear sunscreen all year long, not just on those sunny days. And use one that has both UVA and UVB coverage for the best protection. Here's what's coming up next on the show. Why a pediatric dentist is the right choice for your kids. And the importance of pulmonary rehab to help breathing issues.
Don't let concerns about healthy blood sugar levels control your life. Take control with diet, exercise, and Axilin. Just 2 Axilin tablets each day help support healthy blood sugar levels. Axilin's key plant-based ingredients help your body process carbohydrates and fats. And Axilin is available without a prescription. Control your life and your lifestyle with diet, exercise, and Axilin. Order today at Axilin.com or Amazon.
Going to the dentist for kids can be scary, but not when your dentist specializes in pediatric dentistry. It's their goal to start children off right when it comes to dental health and ease their fears.
Hi, I'm Dr. Bill Wagoner. I am the owner of Pediatric Dental Care and Galaxy Smiles. Been in Las Vegas for over 20 years, and I've been a pediatric dentist for nearly 40 years. We are a pediatric dental care office, which means that we only treat children, and that's because that's what we like to do. Pediatric dentists actually do 2 to 3 years of extra schooling after dental school. And in that training, we learn about growth and development of children, growth and development of the jaws, behavior, normal behavior and abnormal behavior of children, and we learn how to best manage that. We're also very blessed to have a lot of dental assistants that have been in pediatric dental offices for many, many years, some for as many as 15 or 20 years. Most of them also have children of their own, and they're all very good at helping anxious children feel more calm in the dental setting. Our goal is to have children come to the office and have a very positive experience. We want the child and the parent to feel a friendly welcome when they step in the door until the time they leave.
My name is Dr. Audrey Niam, and I'm a pediatric dentist here. I love seeing the kids, grow up and, just checking on the progress and just seeing that, as time goes on, the more they get acquainted with our office, like you can tell that they really enjoy themselves, and that brings me a lot of joy.
We've always tried to make our offices kid-friendly. And recently we've teamed up with a group called the Smile Defenders. So we've got Captain Super Smile, we've got Sparkle, X-Ray Boy, Fluoride Girl, Grubby the dog. And when kids come, they see all of these posters, and if it's their first visit, at the end of the first visit, they get a superhero mask and a superhero cape. So they get to be a Smile Defender as well.
It's crucial to have kid-friendly, bright colors, fun, and also friendly and warm.
When you walk in, there are superheroes. They do have a TV that the children can watch, and also when the children are getting their teeth worked on, there's a TV on the ceiling that they can watch and feel comfortable.
We take care of the kids, they have a fun time, and we enjoy it.
It means the world to me that I get to bring my kids to the same dentist that took care of my smile, and I trust Dr. Wagoner.
They really treat me with care, they know what they're doing, and they're really nice.
Let their child experience a really friendly and fun dental office.
Don't go away, we have more coming up on Your Health. See how breathing issues can be helped with pulmonary rehab.
Your health is brought to you by Axilin. Take just 2 Axilin tablets each day to support healthy blood sugar levels the easy way. Order today at Axilin.com or Amazon.
Now you can support healthy blood sugar levels the easy way with Axilin. Just 2 Axilin tablets each day help support healthy blood sugar levels. And Axilin's available without a prescription. Order today at Axilin.com or Amazon.
Pulmonary disease can cause severe breathing issues in patients, but with pulmonary rehab, these patients can be helped immensely.
Breathing is essential to life. If you can't breathe, it's stressful. Your body, your brain understands that you're not getting the air that you need, and it goes into stress mode, which is flight or fight.
Chronic obstructive pulmonary disease, COPD, is a group of diseases which includes emphysema, chronic bronchitis, and chronic asthma. In addition, you may have combinations of each of these diseases, which makes the group total to 9 different categories of diseases.
It can be genetic that you get from your family, but more commonly it's an acquired disease, most commonly associated with smoking.
The mainstay of treatment of chronic obstructive pulmonary disease is an assessment by a competent physician or pulmonologist with referral to a pulmonary rehabilitation program.
I truly believe in pulmonary rehab, and it has a huge effect on preventing progression of the disease. So it gives my patients the knowledge to have better control of the disease.
I'm a firm believer in pulmonary rehab and its essential role in the treatment of any patient with any kind of lung disease. I was overjoyed to find out that there was a program in La Mesa. Just having a program in East County has been a godsend, literally. I've been so impressed with just how much your staff cares about each individual patient. No one ever hugs me after I give them an inhaler. But I get hugs after I send people to pulmonary rehab, and especially La Mesa Pulmonary Rehab.
Wow. The best part of coming to La Mesa Rehab for pulmonary therapy is that I've got my life back again, and this is part of my life. I wasn't even able to feed him before I got to La Mesa Rehab, and now I'm able to walk him up and down the stairs, and it's just been a wonderful experience for me.
Now I can walk on the hillside. My breathing is much better.
They smile, they laugh, they rediscover the joy of living. So less than 3% of patients in the United States with COPD get pulmonary rehab. It's a huge problem, and one that pulmonologists and our professional organizations are trying to address. Many voices create a loud noise, so it's really imperative that people talk about this and talk about it to their friends, to their neighbors, and just start getting people engaged.
People ask me why I'm so passionate about pulmonary rehab. My own father died at the age of 72 from emphysema. I know we could have increased his lifespan by another 10 to 15 years if he had had access to a program like this. Pulmonary rehab is life-saving, and I want to bring this program to as many people as possible.
Thank you for joining us on Your Health. I'm Erica Cardenas. See you next time.